Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. As we close this 2018 year, I'd like to just take a moment to thank all of you viewers and subscribers for allowing me the opportunity to participate in all of your healing and corrective exercise programs. It's been both a pleasure and an honor. I've put together a unique patient testimonial on how corrective exercise can make such a huge difference in one's life to end this year with. I hope you enjoy this inspiring story, and I look forward to 2019 and bringing you a lot more of these great healing and corrective exercises. Tell them a brief history of your MS and how long it impeded your walking and the difference since you've been working with these exercises.
I've had MS for 40 years or so, and it first started affecting my walking about 20 years ago. And for the last 10 years, I've needed either crutches or canes. And when it was at its worst, I've used walkers and wheelchairs.
And how long you've been doing the posture size, the exercises for, and thinking about your corrections and your core and trying this? 2 years?
It's been a good 2 years.
All right, so let's show everybody how you can walk now, your new style of walking. We'll walk from there down to the end.
Without using my crutches.
Without using any assistance.
Okay. I can now walk and turn around, walk back.
That's pretty impressive. From just changing the way your posture is, the way you've learned how to use your various joints and recruit certain muscles and to work on your balance training.
That's been for about 2 months now I've been able to do that. And prior to that, I could not have made that walk.
Awesome. That's just awesome.
For years and years and years. And it's very much fun.
I would
very much fun.
I would definitely agree with that.
Wonderful to be able to do that. I still don't trust it enough outside. I use my crutches or for any distance, but I can do this for short walks. I have to do it very carefully, but it's possible and it's fun.
It's fun to watch the progression.
Yeah.
Hi everyone, Dr. Remy from Posture Size. The story you have just seen highlights the far-reaching effects of corrective exercises. When this patient first came to me several years ago, he told me that he had multiple sclerosis and, quote, "There's something wrong with my legs, doc. Can you help me?" Well, besides his MS, he had some significant postural issues. Specifically, what he had was a tendency to laterally translate his pelvis to one side. Because his MS had affected more of one leg, specifically his quadriceps and his glutes on that side, he had tried to lean to the other side where he still had more neurological control. As a result, though, over time, many years, this had developed quite an asymmetry in his muscular balance and altered his normal mechanics as he walked. And he had a compensatory hip hiking tendency on that side, and also he overdeveloped his abdominal and back muscles in such a way where it led to lateral flexion or a torso side leaning tendency. So much so that when we tested him under slight unstable conditions, he always began to fall to the right side because his torso was moving to that one side. So it was quite clear that he had a lateral stability issue more than any other plane of motion. And it was also complicated by the fact that he had a lateral tracking patella. He had a knee that was hypermobile in extension. On his bad leg that he couldn't rely on his quadriceps or his thigh muscles for support as he tried to walk. He would artificially slam his heel down on the floor, a passive way of extending the knee. Over time, this created instability or a stretching out of his posterior knee ligaments, and that was contributing to his abnormal mechanics as well. He also had a forward head posture, which stressed his spinal muscles from his neck and head all the way down to his lower back. That synergistic dominance or overcompensation of those muscles helped to target a weakness in his main hip extensor, his buttock glute max muscle, and that was also associated with very weak calf muscles, his gastrocnemius and soleus, as a result of his MS. So we weren't sure what we were going to wind up with initially, but we isolated all these various mechanical issues. We taught him exercises to target the local tissues that were weak in order to recruit them. We taught him other exercises to inhibit the overactive muscles, and we began to, although there were some days where he didn't have much control of his body because of his MS flare-ups, there were more days than not when his MS allowed us to make gains in his therapeutic exercise program. And over time, he began to learn how to properly hold himself, recruit the proper muscles, and we began to strengthen that through exercises that were conditioning exercises. We then took those basic isolated movements and integrated them more into full body motions, included standing on one leg, squatting, lunging, eventually one-legged squats, all types of calf and balance exercises. We took torso exercises, both in terms of abdominal and back conditioning exercises, to teach him how to properly recruit his torso musculature, his core musculature. Many muscles were weak. And as a result, over time, he began to notice that he had more stability, more confidence, and the strength in his mid and lower body to be able to walk more correctly. And as the exercises went on, we began to delete stability. We began to use more eyes closed training while he was standing, holding on to the wall or to the therapeutic rack. And after a while, we actually began to take away the touch, so he was relying on his own stability. And this created a new sensory motor reflex in his body, several of them, depending on the specific exercises and stability issues we were targeting on with that particular exercise. And as a result, he began to improve his gait cycle. What's important to note here is that we in no way cured his MS. We didn't change his MS, but what we did is we corrected what could be corrected. And similar to a lot of people that come to the Posture system, whether it's an arthritic disorder, we've had patients with hydrocephalus, upper motor neuron problems, where many times you get a particular diagnosis and you think that's all that can be done for you. There are many times the typical postural issues that we all suffer from because most of us aren't symmetrical in our body habits. And these postural issues many times play a larger role than we think in terms of our ability to function, to be stable, to resist soft tissue irritation and stress that causes musculoskeletal pain, and they really inhibit our daily activities and our quality of life. So fortunately for this patient, we were able to restore a more normal gait cycle, get him into a conditioning program which helped him in other ways in his overall health complex, and we improved his overall quality of life.